Good afternoon, everyone. This is Sauro Arakinians, your clinical pharmacist. I want to discuss a few of the DOAC options available in the market and their indications. Starting from Xarelto, Eliquis, Savaysa, Pradaxa, and Bevyxxa. Xarelto has about 10 indications to reduce the risk of stroke and systemic embolism in non-valvular AFib, treatment of DVT, PE, reduction in the risk of recurrence of DVT and PE, the prophylaxis of DVT, which may lead to PE, the prophylaxis of venous thromboembolism to reduce the risk of major cardiovascular events in patients with coronary artery disease, reduce of major thromboembolic vascular events in patients with peripheral artery disease, treatment of VTE or venous thromboembolism, and reduction in the risk of recurrent VTE, and prophylaxis in pediatric patients 2 years and older with congenital heart disease after Fontan procedure. Then we move to Eliquis, which is a factor Xa inhibitor to reduce the risk of stroke and systemic embolism in patients with non-valvular AFib, and the prophylaxis of deep vein thrombosis, which may lead to pulmonary embolism, the treatment of DVT and PE for the reduction in the risk of recurrent DVT and PE. We will move to Savaysa, which is a factor Xa inhibitor to reduce the risk of stroke and systemic embolism in patients with non-valvular AFib. Bevyxxa, factor Xa inhibitor for prophylaxis of venous thromboembolism in adult patients with hospitalized for an acute medical illness who are at risk of thromboembolic complications. And lastly, Pradaxa, which is a direct thrombin inhibitor indicated to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation. Again, this is a summary information about the DOACs, Xarelto, Eliquis, Savaysa, Pradaxa, and Bevyxxa, and their indications. Hope you enjoyed this video. As always, stay safe and take your medications.